Hi, everyone. Welcome to our Faith Health Connection today, Living Healthy with Chronic Disease. I'm Krista Westervelt, an Associate Director here at PHW in Healthy Aging. I was looking at the chat, I was like, oh, it's just Arlisha saying welcome. Welcome, everyone. We'll do a quick opening prayer as we often do, and then we'll get started. Spirit of wisdom, clarity, and peace, guide our minds and hearts as we partake of today's presentation, that we may carry its learning into our contexts and communities to support the thriving and wellness of all who we serve. In gratitude, we pray. Amen. So today's guest is Vivian Geddes, who does chronic disease project management with Healthy Aging NC. And I'm going to stop sharing my screen and welcome Vivian to the program. Thanks for joining us, Vivian.
Absolutely. Well, thank you for the invitation. I'm really excited to be here with you today and really sharing some information about the chronic disease education program that we're offering through Healthy Aging NC. So should I just go ahead and share my screen and get started?
Yeah, the floor is yours.
Very good. Okay. All right. Hey. Hold on one second. I'm going to try to get the slideshow going here. Okay. There we go. Okay. Everybody see the slides okay?
Yep.
Very good. So as Krista said, I'm representing the North Carolina Center for Health and Wellness at UNC Asheville, and we provide chronic disease self-management education programs in North Carolina statewide through a variety of funding and resources. So today I wanted to share with you a little bit about what we offer, and hopefully they'll be able to meet some of your needs in the communities that you serve. And as Krista said, I'm the project manager, and I work with a team of individuals, and they all are working together to promote healthy aging across the state. And we work in partnership with community organizations statewide. And the area agencies on aging is one of our primary partners, but we also have other community partners that we work with throughout the state to provide these programs, including things, organizations like YMCAs, libraries, and even many churches throughout the state also offer these programs. My background is in nursing and public health, and we have other managers that support programs, including Natasha Voss, Ellen Bailey, and Nadia Maza. And as I mentioned, we are federally funded, and primary funding comes from Administration for Community Living. We've had a variety of grants, as well as the Centers for Disease Control and Prevention. We're excited to get this funding, which makes these programs available at no cost to participants. So we do have quite a lot of resources that we've been able to make available through this federal grant funding. And we do also receive some state funding. So today I thought what we would do is go through sort of an overview of the Healthy Aging NC supported programs that we provide statewide. These include falls prevention programs, arthritis and physical activity, and chronic disease self-management programs. And today specifically, I wanted to talk more in depth about the Living Healthy with Chronic Disease, so you become more familiar with what we offer through that program. And also, I would like to discuss a little bit about how to become a program leader, host workshops, and even refer participants to these programs. And we'll allow time for a question and answer at the end of the program. And I did make this slideshow available to Krista so that she can distribute it to any attendees that would like to reference it later. So I thought we'd start off just discussing, why are community-based health programs important? So what we know, and I'm sure you've seen this in your own communities, that people are living longer and they do want to remain in their home and community as they age. More and more we're finding retirement communities, that are really a vibrant community, and that you no longer have to feel like your only option is to become a resident like in a nursing facility. So most people, when they age, do want to be in their home as long as possible or in the community. We know that people only spend about 1% of their time receiving direct health care in a provider's clinic or office. So community-based health programs really become very important because as people age, we are seeing chronic conditions. And so these programs that are evidence-based and provided by leaders that are trained in the programs really help people stay physically active. They decrease their fall risk. And these are proven approaches that help manage chronic conditions. And more, you've probably been hearing a lot about these age-friendly communities that are really part of the AARP efforts to really promote healthier and more livable communities. And North Carolina, I just wanted to mention, has several communities that are part of the age-friendly community effort. And North Carolina now as a state has joined this network of the age-friendly communities. And they really focus on several domains of healthy living, which you'll probably be hearing more about. So when we talk about evidence-based programs, what exactly are we talking about? These are programs that offer proven ways to promote health and prevent disease among older adults. And they are based on solid research and that the health benefits are well documented so that they can be applied in a variety of settings and communities. And if you think about it, if older adults are spending more time in the community, it makes sense to provide these healthcare community and healthcare resources that are available through trained leaders and these evidence-based programs that can be provided in many community settings. So what are the benefits? You might be asking yourself, if I attend one of these programs. These programs address specific problems. As I mentioned, some of the goals are to reduce falls. Some of them are to reduce arthritis. The chronic disease self-management programs really work with individuals that may have chronic conditions like diabetes, arthritis, might have health problems. So these are specific problems, and their goals are to address these ongoing health problems associated with these problems. And what I really like about these programs is that the participants actually choose their goals and they can track their progress towards success. And also what I like too about these are workshop style programs. So there's usually a group of about 15 individuals to get a lot of social support, people that have similar problems or conditions and experiences. So I think that social interaction and support is really essential part of the workshops. And the leaders are actually peers. They're peer leaders. So they may have a chronic condition themselves. They could know or have be a caregiver to someone with a chronic condition. So they have lived experiences as well. They do offer guidance. There's science-based education that's provided, but really the participants use that information to develop their own skills to manage their chronic conditions, and they find the solutions that work for them. And they do that individually, but it's really neat to see how the workshop the participants start really providing all the social support and even some ideas that they can try to manage their conditions. So I do think it's really quite a nice process to see. So these are the evidence-based programs that are supported by Healthy Aging NC, as again through some of the research and the program funding that we've received. These include A Matter of Balance, Tai Chi for arthritis and fall prevention, the chronic disease self-management programs, which we call the Living Healthy suite of programs, Living Healthy with Chronic Disease, Diabetes, and Chronic Pain. And one of our newest programs is the program to encourage active, rewarding lives and the Walk with Ease program. So I'm going to talk to you just briefly about these, and then we'll talk more in depth about the chronic disease self-management programs. And some of you may have heard of some of these. These programs have been initiated throughout the state. The metropolitan areas have pretty well established, and we're really trying to expand some of the programs in some of the rural areas. But this particular program is a fall prevention program, And it's really, for people who need to decrease their fear of falls, increase their activities levels. And typically there's 2 trained coaches. It's a group of 8 to 12 participants. And this one lasts for 8 weeks. The Tai Chi for arthritis and fall prevention is probably one of our more popular programs. This is ideal for people who need to improve mobility, balance, strength, flexibility, relaxation, and self-awareness. This program is led by 1 or 2 trained instructors. We have a group of about 6 to 18 people, and this is a nice program because it's a little bit longer than some of the other ones. This is for 16 weeks, and people just love the Tai Chi. There is a North Carolina Falls Prevention Coalition that's been newly established as a result of one of our activities with Healthy Aging NC. It's got all kinds of information. So I encourage you to check out the website, North Carolina Falls Prevention.org. There's fact sheets, brochures, lots of great information. So just check it out to see what you can do to prevent falls. The Walk with Ease program is also a program that we enjoy offering because it's for people who are kind of new to physical activity and they need to kind of ease into it with a walking program. But it's nice because it's in a group. So folks who maybe haven't been physically active, or they maybe still have some pain with activity and they just need some support, this program is definitely worthwhile to pursue. This is also a very popular program. It's led by 2 trained instructors. It's a nice group, so sometimes having someone to walk with or to be active with, it's nice to have someone that you can participate with. And these are 1-hour sessions 3 times a week for 6 weeks. The Pearls program is the program to encourage active, rewarding lives. And this one is really nice because it's a way for people to get support, to build their confidence, to improve their emotional health, and to be more active and fulfilling, and to lead more active and fulfilling lives. This is a one-on-one session led by a trained coach, and these are 8 sessions over a 5-month period. And what we know is a lot of older adults, and you may have seen this too in your communities, some of them are very isolated. They're living at home, but they're not as socially active, and they may have some emotional issues they're dealing with. So they just need some support. And so this is just a picture of one of our Pearls participants. She says this program has been a lifesaver for her because she was very socially isolated. And now has a really awesome social life. And so we're really excited to be able to offer this now. And we offer this statewide in a virtual session, and then in person is in Charlotte, in the Charlotte area. Okay, well, this leads me to our chronic disease self-management education programs. We actually have several under that umbrella. The chronic disease self-management program is really sort of an all-inclusive for all chronic conditions. And then the other programs for pain and diabetes really spend more time on those specific conditions and more specific techniques and tools that you use for those programs. We also offer this program in Spanish. So let's just kind of talk a little bit about the Living Healthy with Chronic Disease. This is the one that's for all chronic health conditions. And what we talk about is really discovering how to manage symptoms through lifestyle modifications. And this is led by 2 trained instructors. The group is about 8 to 15 participants. And this is a 6-week workshop. And we meet as a group 2.5 hours once a week. And I am one of the trained chronic disease self-management facilitators. So I'm real excited to be able to talk to you about this today. It's really awesome. It's an awesome program. And we know that in North Carolina, 8 out of 10 adults age 65 and up have 1 or more chronic conditions. So I'm sure those of you listening in and attending this webinar probably know of somebody in your community or in your family that has a chronic condition. And so what we're encouraging through these evidence-based programs is becoming an active manager. You know, that's sort of a mindset we really are trying to instill, that we can take control of our health. Especially since we only spend 1% of our time with the healthcare provider. So it's important to become more active managers. And this is what we really emphasize as part of our Living Healthy with Chronic Disease suite of programs. So to become an active manager, we really focus on chronic disease symptoms and the tools that you can use to break that symptom cycle. And those of you maybe that have a chronic condition experience many of these symptoms: poor sleep, pain, difficult emotions, maybe shortness of breath. And these are symptoms that can work to make your life difficult to navigate. And, you know, if you can imagine having these symptoms, and they can kind of work together to make it worse. If you're having pain or stress, then that typically has an impact on your sleep. So what's important for us to understand is that, and what we teach in the workshop, is that we can become active managers through using these tools in the toolbox. For example, a good one is just being more active, the physical activity. That really can break the symptom cycle in a number of ways. It can reduce some stress, fatigue. Just being able to be active can also improve, you know, your physical limitations that you may have had. But very importantly, what we talk about is problem solving, decision making, and creating action plans to become action oriented. So we learn a lot about these symptoms, and we gain quite a lot of ideas about how to resolve the symptoms through these tools, such as physical activity, using your mind, understanding emotions, making decisions, healthy eating. These are all lifestyle-based ways to manage symptoms. So this is really how we promote self-management and becoming actively managing your symptoms. And I just want to give you just an idea of one of our sessions. As I mentioned, I'm a chronic disease self-management facilitator. And what we spend a lot of time on is activities and learning, active learning. I think adults really enjoy that, and quite a lot in terms of the interactive nature of these workshops. And every participant receives a wonderful manual that has a lot more information. We provide some, not homework, but some reading chapters prior to some of our educational programs, just so that they can get more in-depth knowledge with these different topics. So as you see here, for session 4, what we're focusing on is typically we start with the feedback from the previous week. And we're going to be talking a little bit about action planning in a little more detail in a few minutes. But at the end of every session, each participant chooses something that they want to work on, and they create an action plan. So that's always the first activity for every session, is we just talk about how the week went, you know, based on the action plan that we shared. And it's okay if there were barriers or challenges, and that's really where the sort of the group support helps. If that particular action plan didn't work, choose another one and just keep working on the problem and finding something that does work. For activity 2 in this session, we talk a lot about what causes shortness of breath, and we learn breathing techniques, and we actually practice a lot of these techniques as we're going through the various activities. Another activity for this session is reading food labels, and we spend two sessions on this because it's so important to know the nutrients in the food you're eating and the serving size for each food that you're eating. It's always amazing to see the response when we go through reading the food labels. They learn quite a lot about the amount of sodium in each of these products, their serving size, and so it helps you make better decisions about what you eat, and that's to encourage healthy eating. Another activity is exercise and physical activity. And we do this in several sessions. This particular activity has to do with it's about posture and stretching. And we do actually do a 5-minute exercise together. We do some modeling and then we all practice together with this particular one. Problem solving, I mentioned, is so important because with these symptoms, that can become kind of a vicious cycle until we identify a problem and select some specific ways to resolve that problem and try them out and assess how it went. This is the way we become more active in resolving some of the problems that we're encountering with our chronic condition. So we do spend quite a lot of time on that, and we do the action planning as well. Another very important part of managing chronic conditions is communications with not only in our social relationships, but also with our healthcare provider. It's important, for people to understand your feelings and know what help you need. And so we really practice a lot of, what causes barriers in communication, and also practice some positive communication skills. And as I mentioned, making an action plan is part of every session. And I think this is the one that really creates change in behaviors. So we really do emphasize this a lot. And we always close with making an action plan for the next session. So I'm going to talk to you a little bit about action planning. I'm sure many of you have thought about something you want to change in your life, and but it really helps to go through these specific steps. And it's amazing. It really works when you go through these steps. So I really emphasize this is something that each participant has to decide that they want to do. It's not something that maybe a family member wants them to do, or maybe a healthcare provider, is encouraged, but they have to make a decision. This really means something to me, and this is something that I really am invested in. And then, of course, next, it has to be something that's achievable, very action specific. You typically want to get at what, how much, when, and how often. And this confidence level is important, because typically what we find through some of the research is that if you're not at least 7 out of 10, 10 being most confident, then you probably won't feel like you can achieve this action plan. So a lot of times if people report they have, a confidence level of 4, when they're making the action plan, it's something they really want to do and they have high expectation, but they don't have a very high confidence level. We actually talk as a group as to what we could do to break down some of those barriers, what they could do to take steps to increase their confidence level in achieving this action plan. So that's an important step. And so I thought I'd give you an example of one. And this is something that's very practical that everyone can benefit from, and that's improving quality of sleep. We know that sleep is a very important factor in our conditions and just how we feel every day. So this one is the action-specific part of this action plan on improving quality of sleep is by using the relaxation techniques that we learn in the workshop to manage some stress and worries. Because if you're like me, I'm sure some of you sometimes get stressed or worry about things, and then it's very difficult to fall asleep. And so what we really emphasize with this particular topic is reviewing some techniques that will help relaxation. For example, for me would be reading, or positive affirmations, or gratitudes. It may be something else for somebody else that would help them to relax and to have a good quality of sleep. And my goal on this one would be 1 hour before bedtime and 5 out of 7 nights a week. We find that if you choose 7 out of 7 days in a week, it's probably not realistic. Things get in the way of action plans. And so we encourage people not to try to aim too high, because you want some success, because if you're having success, then it tends to build more success. So, try to start small and then gradually build up, particularly with exercise. It's a really good example of that. So confidence level is 7. So this is something that I feel like I can do. This is one that I chose to do. And the leaders in the groups actually choose action plans that they work on as well, kind of like a modeling. And also is something that we all can benefit from. So this is just one of my examples, and my 2 Westies at home, that get good night's sleep every night. So hopefully you've gotten a little bit of an idea of the Living Healthy with Chronic Disease workshop, and there's much more information when you actually go through the workshop and become trained as a leader. But I want to at least give you kind of a snapshot of some of the things we talk about through the workshop. So hopefully you're interested in maybe hosting a workshop in your community, because we find that, you know, these programs that are offered in places where people are comfortable going to. For example, if you have a health ministry and you have a community room, maybe at your church, or if a library is available, we find that people like going to programs in their community. So hopefully you're interested in bringing some of these workshops to your community. So the things to think about with hosting a workshop is, as I mentioned, you need 2 facilitators for each of these workshops to be implemented. And you have to identify, you know, a host site that's accessible and convenient, and has a nice private meeting room that's available. And I'd encourage everyone, if you're interested, to also check out your local area agency on aging, because they're actually available in every region of the state. There's 16 designated regions, and they receive funding to provide older adults with quite a few resources. So if you don't know your local area agency on aging, definitely get connected with them, because they are one of our primary partners. And so they offer quite a lot of resources. They provide meals, they provide transportation and recreational activities, and these health promotion programs. So check them out. And they have resources, and they are certainly welcoming other partners to help host these programs at convenient locations in their communities. And just scheduling it at a good time that you know people are available, and of course promoting it to your community. Recruiting participants, you know, if you're have a health ministry and you have a pretty active church, you know, put it in the church bulletin. You can advertise, perhaps, you know, in flyers that are put up, and just word of mouth. So I think, you know, people like getting invitations, you know, from people they know. And of course, connect with Healthy Aging NC for support. As I mentioned, this is something that we're really invested in across the state, and we have some resources as well. So we're happy to support these efforts in your community. And of course, you know, we want to help inspire healthy aging by the leaders that are in their community that can provide these workshops. And just think about, you know, people that, you know, that are just natural at interacting with people and enjoy helping others that are part of maybe in your congregation. Could be a retired teacher, retired nurse, but there's no health background is needed, but something that's naturally something that they enjoy doing. So as I mentioned, there's no medical background. We call our leaders lay leaders or peer leaders. And so they're really people like everyone in the community. They have a chronic condition, and they're from that community, and they have this interest in helping others take control of their health. It does help if you have a chronic condition, or a caregiver for someone with a chronic condition, just because then you understand a little bit more about some of the challenges that the participants are experiencing. So that is helpful. So what is leader training? Training is in-depth discussion of the program content. You actually receive a manual with very detailed instructions on activities that I just showed you on the agenda, and all the materials that you need to conduct a workshop. So you don't have to do any research, you don't have to do any reading, you know, it's just something that is provided as on a lay level. It's not meant to be shared in a level that people wouldn't understand. So it's very easy to understand and very detailed leader instructions. The training is 4 days, and typically the training is broken up in 2 weeks. So 2 days 1 week and 2 days another. You do attend the entire training to become certified, and then to maintain the certification, you only need to lead 1 workshop per year. And the nice thing about right now is that we do have grant funding because we are in the midst of a 3-year program. So we're excited to be able to offer these workshops free of charge, and the leader training, all the expense paid leader training for this particular program. So this is a good time if you're inspired to become a leader for the Living Healthy workshop. So this is excellent timing if you're interested. I'd love to hear from you. Also, if you just know of folks in your community or in your congregation that may have a chronic condition that's maybe struggling, that could use some support, there is a way just to refer participants, or if you want to refer yourself, you can do that too. And the way you do that is you just go on our Healthy Aging NC website, and we have quite a lot of information about our programs and resources, all free of charge. We have information for our program providers, our clinical partners, and for anyone that just wants information. So just go to our website and check it out. And you'll see a referral if you want to make a referral. And you also will find this map of all of our programs that are available statewide. And you can do a search for your location or dates or program name. But if for some reason you don't see it or you're not sure how to find it, you can just email us. And there is just an easy to fill out, quick 5-minute form that you can fill out. And that'll come to us, and just to us. And then we can answer your question or get you connected with the workshop that's in your community. Well, hopefully you've enjoyed seeing some of the information I've shared today, and the next step would be just to explore some of the programs in more detail on our website, and think about whether your congregation or your church could host a workshop. There is a virtual chronic disease self-management workshop that's coming up soon. I wanted to let you know about it if you just want to test it out and see what it's all about before deciding. I'll be a leader for this particular workshop, and my coworker, and it's virtual, which we've started offering the virtual. They are offered virtual and in person, but we find that the virtual option is a good option for some people. So it'll be on Tuesdays, July 16th through August 27th from 1 to 3:30. And once I get the flyer put together, I'll send it to Krista, and she'll get it out to everyone just with more information and registration. And I mentioned referring participants. If you know of somebody that would benefit from one of the workshops I mentioned today, feel free to refer. And also just think about connecting to community volunteers for leader trainings. We're in the process of recruiting leaders in communities that are underserved with chronic disease self-management. So we'd love to hear from you all if you're interested. And so just reach out to me with questions. My email address is vgettys@unca.edu. I want to thank you today for listening and participating in this webinar, and hopefully you found some useful information about workshops that we offer and becoming a leader yourself. Thank you again, and I'll go ahead and end that. And this actual presentation will be available, so I'll make sure that you all get that if you're interested. Any questions? This question and answers.
Feel free to either use the raise your hand or just unmute if you have a question that you have for Vivian.
I see some chat. Let's see.
I've been sharing links in the chat.
Oh,
so in the
yeah,
chat, we've got, if you're looking for their area agency on aging, or patient resource map, you could just find your county. It'll have that on there. And then we've got the Healthy Aging NC website as well as I added the NC Falls Prevention. And all of this will go out. We have a PDF that will go out to y'all as well. Well, thank you, Vivian. It's quite robust. I know those programs are really popular. When I was at the Council on Aging in Chatham County, I know we had the Matter of Balance class, and then we also had the chronic disease self-management course, and those are really very popular, very well received, and very effective programs. I know Steve mentioned sort of wanting to get to some other areas of the state that might be underserved? Are there particular counties or areas of the state that you are most
Yes,
interested
there
in?
are. Mhm. There's 5 regions of the state, and typically, the metropolitan areas I mentioned are pretty well established. Those would be like the Charlotte area, Raleigh-Durham, even some of the Asheville area is pretty well represented in Greensboro. But what we're finding is some of the rural areas and, the southwestern part of the state, the very southwest, that would be an area these would be like Cherokee, Clay, Graham, Haywood County, and I'd be happy to provide anybody with any more information about those regions. But the other one is the High Country region, sort of where Appalachian State is, some of those areas. Although the Area Agency on Aging contacted me and they're really recruiting leaders. So I'm excited that they're on board. They do a lot of falls prevention programs, but so they're really anxious to get the chronic disease self-management programs out there. So those two in sort of this part of the state, and then the Curtar region, that includes Granville County, Vance, Warren, and Person County. That's another one. And I have to say, some of the libraries, I've done some outreach with libraries, and some of them are really interested. So that's very encouraging. And then the Mid Carolina region, it's 3 counties. It's Harnett, Cumberland, and Sampson County. So those of you that are working in those counties or have health ministries, I'm certainly open to any suggestions you have to link with churches in those areas. And probably the one that's probably furthest east is called the Albemarle area, and it includes Currituck, Washington, Tyrrell, Chowan, Gates. It's very eastern part of the state. So those are the ones that we'd love to encourage people to, particularly churches, faith-based organizations, and libraries, to host these programs. Because I think what we're finding is some of the area agencies on aging, they're limited with regard to their staffing. And so we decided that we're going to do some outreach and start trying to recruit leaders that are from other organizations, but they have resources, the workshop manuals, that can be made available at no cost. And as I mentioned, the leader training would be at no cost as well. So it's definitely a win-win situation if we can do some outreach in some of those areas.
For sure, yeah, and then it's accessible because of the free trainings, which is helpful. So it might be helpful even for congregations to consider partnering with the local library or partner with other congregations in the area and see if there's interest in maybe a leader from each congregation taking a training and kind of tag teaming some programming throughout the year. I mean, there's ways to make this accessible for sure.
I think so too. And I think, we wouldn't want to feel like this is a burden for any community organization. Being a leader myself, I've seen a lot of the benefits in the workshops, and the participants love it. It's so interactive and so supportive, and it creates a lot of bonding among the attendees. And we actually like for them to pair up to be like a support buddy, so that, even after the workshop, they still have support systems in place, so I really think it's an excellent workshop, and we really encourage you all to think about that.
And I feel like it's too a good opportunity maybe for congregations who have certain members who perhaps are dealing with chronic disease and who might not have necessarily seen themselves as a health leader in the church, but seeing that like, oh, here's this thing that I'm going through, and then I can also partner and learn and help share my experience and help others as I'm helping myself. And so it might be a way to sort of get some folks within your religious community or faith community involved in a way that empowers them to help empower others as well. So something to think about.
Absolutely.
So maybe have
Absolutely.
the same people always leading. There might be some unlikely leaders who are in the mix. So I see something in the chat. Stephanie says, I'm a current leader for Living Healthy with Chronic Disease and Living Healthy with DM. Is that related to diabetes? Any thoughts on how to integrate faith with the established program and keep the fidelity of the program since this is on a faith-based platform?
That's a great question, because we know that spiritual health is part of health and wellness. And I think particularly since we do talk about emotions and stress and then relaxation, we actually do a meditation exercise. as part of one of the relaxation techniques. So I do think anytime you can, work that in as a technique, in terms of what's in the toolbox, and it's your spiritual health, and so for me, I think, linking spiritual health with physical health as part of your emotional well-being, that's how we've linked it. And I do think that's an important component. And like I said, we do quite a lot of those kinds of exercises. And I'm not with the diet, you're a leader there. Have you tried some of those, or what are your thoughts about it? It's Stephanie, I think, from Atrium Health. I'm not sure. Can you unmute yourself and tell us more about what your thoughts are? She might be having difficulty unmuting, but hopefully that'll help with some suggestions.
I mean, I feel like you could probably, like in looking at sort of the layout of a workshop day.
Yeah,
Oh,
I'm
yeah.
sorry, I was
Yes,
having trouble
Stephanie.
unmuting.
All right, there you go.
Okay. I was so glad that you said you're a leader. So maybe you can tell us more about what you do and what you've seen in your workshops. And like I said, prayer and meditation is one of the techniques that we encourage.
Yes, I've, led the meditation forum and went through the training through my area agency on aging. And, they've strongly encouraged staying, very by the book. And by the book does have this meditation activity that you're speaking of, but
Right.
that's about the only way faith is intertwined. Like, like you say, you were encouraging churches to have this, so there's no scripture, with it or anything. But I have been told that someone associated with our new Advocate Health, since that I'm with Atrium Health, has started weaving in faith into their program. And so I didn't know if that was something established already, or if that was just something this individual was doing. So that was one of the main reasons I signed up for this, being that it was on Partners in Health and Wholeness, thinking maybe that y'all were going to talk about how you can intertwine the two programs together. So
thanks for bringing that up, because I probably could have spent a little more time on that. But I agree. I think what you'll find, and the reason the fidelity is so emphasized, is because it's an evidence-based program. And you do have to share that specific knowledge base and those activities to make it work with the proven strategy. However, that being said, when you look through your leader manual and it says in your own words, that's when you can really, and there's every session has that in your own words, depending on your audience. So I would encourage you, where it says that means that particular piece is where you can make it real for the participants and relate to them in a way that they would understand and feel good about or comfortable with. But the other ones that are, are pretty, it's like a scripted kind of thing. It's because it's the science base behind it. So, but as long as you cover that, and then when it says in your own words, then I would encourage you to explore that more, when you're doing work with the faith-based organizations, or, as part of a health ministry.
Thank you.
Any other questions or thoughts about this? Anyone have a chronic disease that you want to share about, and how you're an active manager? I'd love to hear more about that.
It's just being mindful that this is being recorded, so don't necessarily share
That's true.
personal health information.
So I know somebody that
Speaking for a friend, yeah, I wondered too, like when there's sort of the personal goal setting. I mean, I think even if people made, the health-based goals and then sort of spiritual practice goals to go alongside them, for instance, perhaps along with it, or
yes,
different kind of rituals to end the day to get better sleep. That could be some faith-based ritual around it as well. So there's a lot of room for making it fit what works for your particular faith community, because every faith community looks a little bit different. I think earlier I'd seen Brad, you started to come on off of mute, and I wasn't sure if you maybe had a question or a comment.
Yeah, I have a question. right now, the training and different things are funded. Are the classes themselves something that the participants pay for? Is that all done free? So, and when the funding ends for the training and stuff, what does that look like if for future trainers if somebody decides to do it later?
Well, thanks for
What-
asking that question. That's something I'm glad you brought up. As I mentioned, with the federal funding, we're providing quite a lot of resources throughout the state. And the Area Agency on Aging is one of our primary partners. And like when I do outreach, I always want to connect to the Area Agency on Aging because they get federal and state funding to do health promotion programs. But what they're lacking are leaders, so, and their capacity of staff, to be able to lead the program. So they have resources this is typically age 60 and up, and because of their funding. And so they can maintain the programs even after this grant. We still have another year of the grant that I'm working on now, but by connecting with them, they'll see that they'll have the sustainability of the programs. They have the manual, the workshop materials. They can actually train leaders, and we have master trainers throughout the state. And some of them are linked to an Area Agency on Aging, which is great. So it doesn't cost them anything, to do the training. So that's kind of what we're looking at this point. But if you have other ideas, I know Partners in Health and Homeless does grants. I know North Carolina Rural Center provides community grants to fund some of these things. So hopefully there's enough resources, by using some of these other resources as well.
Thank you. Yeah, and it's my understanding, right, for the Area Agencies on Aging, that's coming through the Older American Act, right? So this is, and that's some pretty robust long-term funding if that continues on, and something to keep an eye on. I know often we talk about, as part of the North Carolina Council of Churches, looking at what the different legislation is that's coming down the pike that affects our health and well-being. So keeping an eye on what is always going on related to the Older Americans Act is definitely worth keeping an eye on. But yeah, there's funding out there, and a lot of it's just like getting people connected in to take advantage of the funding that's there. And so this is where the faith communities come in and fill in the gaps, and to show up and offer these programs. And oftentimes older adults and communities might not necessarily think to reach out to these different agencies, but their faith leaders can connect them, like, hey, there's resources in the community, let's take advantage of it. So everything you can do, that's great.
Most definitely. Yeah, and you mentioned we do have a group that's going to the Capitol next week. We're actually going to be in DC as part of the National Coalition on Aging. And we're going to be visiting legislators because the Older Americans Act is on on our list for expansion of funding. So I'm glad you brought that up. So I have an opportunity to mention that we do have people that are really boots on the ground talking to legislators. Anytime you can talk to your legislator about some of this Older Americans Act funding, it's also very helpful. And that's part of what is funding this project, is funding through them.
Yeah, and that funding goes to so many different things you don't even think about, but it's out there and it's doing great stuff in the community. So it's very important, especially as our population ages pretty dramatically. Anyone else have? Okay, sorry.
Totally. And I was just gonna say, the Division on Aging, Division of Aging is a department of the North Carolina Health and Human Services, and they are very focused on this as well, and they're very supportive of it. So they're always looking for grant funding. I know right now they're looking at funding for internet service and navigators to help older adults with navigating some of the technology, and trying to do a lot of work that way, just so they have more access to health information and that kind of thing.
Sure. Anyone else have any questions for Vivian or anything about what we explored today? Again, it's very robust, and I think people will probably really appreciate to have the slides in their not quite literal hands, or they could print them after we send them out, because there's just so much out there. And I think just the awareness of knowing that these programs are out there, that they are offered across all these counties in the state that maybe we weren't
Mhm.
even expecting them to be in. And it could really improve the quality of life of the folks in our faith communities. It's so tremendous.
I agree. Yeah, and really take an active part in getting the word out to people
Yeah.
that could benefit from these programs. I think that's essential because I think what I've seen, particularly in other states, just getting the word out. And I think there's people just don't know about the programs.
Yeah, exactly. Like if your faith community doesn't have the bandwidth yet to run it, but you can make people aware of where it's located or help each other with transportation to those sorts of things or make it more accessible to folks. I think that's also a key part of this. So yeah.
Absolutely. Yeah. Well, join me for the upcoming workshop and you'll learn a lot more about chronic disease self-management. I appreciate the opportunity of
Of
being here
course.
with you.
Of course. Any other questions from folks? If you think of anything after the fact, of course, we can reach out to Vivian. We could get those answered for you. Just a quick reminder of what we have here at PHW. If you haven't already taken a peek at it, I encourage you to look at our Healthy Aging Inclusion Plan, of which this type of programming fits in well with it. We look at several different elements of healthy aging and wellness and aging and how your faith community could be more inclusive of folks across the lifespan. So if you haven't had a chance to take a peek at those, I highly encourage it. It's workbook style, and you could approach it the same way Vivian was talking about creating action steps and plans. You can definitely come at it that way. If you have any other questions about our healthy aging programming, you're welcome to email me, Krista@ncchurches.org. And of course, if you want more information about what's going on at Healthy Aging NC, you could visit their website. It's also in the chat. You can visit our website at healthandwholeness.org or follow us online.